husband, Asuquo, and our son, Keinabasi Asuqo. We gave birth at this hospital, Evercare, September 29th, 2021. And a week after, when we came for circumcision, Dr. Arua called our attention to an obstruction in our son's urethra, and he needed surgery. It was devastating, to say the least, given I'm a first-time mom, and I just gave birth, had a CS, and then I had to deal with this for a newborn child. So Dr. Arua tried to, not that he tried, actually he did a good job, talking to us, trying to, tell us that it wasn't such a big deal. He wasn't even doing any cuts, and that it would be non-invasive. There will be any scarring. It was going to be pretty simple. In fact, 45-minute stops, and he was right. We had the procedure, and in less than 3 days, he was peeing fine. The pain he was experiencing when he was peeing wasn't there. It was good. Surgery went well, and everything was fine, and we went home.
Keinabasi was diagnosed for PUV, like my wife said, a week after he was put to bed. And Dr. Arua took it up upon himself to make sure we had the best care at Evercare. Gave us all the assurances that we needed, and made us very, very relaxed, and told us we had nothing to worry about. First-time dad, it wasn't so easy to accept it, but with God on our side, with faith in our hearts and everything, we had to do the procedure. Bearing in mind that Dr. Arua also mentioned it was a minor one, so we didn't really have much to worry about. So we did that, and everything went fine. It was smooth. After we concluded the PUV, the first surgery, we came for periodic checks, and in the process, he was diagnosed for another condition, which, if my memory serves me correctly, he called it urethral re-implantation. He was diagnosed for urethral re-implantation. Not as minor as the first one we did. This, according to him, was a major one. It didn't come we didn't take it lightly, because he was barely 3 months old for the second one. I remember my wife, I had tears in my eye, but I remember her crying. She cried, but I had to be strong for her, console her, Then with Dr. Arua's guidance through the entire process and everything, we built the confidence that we needed, and everything went through and happened successfully.
My name is Dr. Igwe Obasi. I'm the consultant pediatric surgeon at Evercare Hospital, Lekki. I met Keinabasi when he was about 2 weeks old. The parents complained of straining and difficulty while passing urine. So that led us to do further investigations using X-ray and ultrasound, where we identified that he had an obstruction at the posterior urethra. So this kind of obstruction requires that there will be a surgical removal of the obstruction, what we call the posterior urethral valve. So we did an endoscopic ablation of the valve, and the child had significant improvement in his urination. Due to this obstruction, occasionally there may be a backflow of urine to one or both of the kidneys. And it happened that Keinabasi also had a backflow on the left kidney.
Timelines between the surgeries were, the first one happened when he was about 2 weeks old, 2 weeks, 3 weeks old. The second one happened when he was about 4 to 5 months old. So everything happened within the first 6 months of life, or first 5 months of life. We've had 2 surgeries. He's been to the theater 3 times. The third one, they had to remove the stents that was put in when they had the second surgery, so he had to go back to the theater.
The interesting thing about Keinabasi is that we did his own operation laparoscopically, meaning that we use minimal incisions and use of technology to do the procedure. Hence, we avoided giving him a big scar and he was able to recover very quickly from the procedure. One of the good things about this procedure is that you get to see how quick your patients can recover and they get to go home on time. The fact
that we're able to diagnose our baby's health situation at the time is our biggest testimony. Thank God for an institution like Evercare that had all the facilities. I was able to understand that if it wasn't for Evercare, we probably wouldn't have had that surgery here locally. We'd probably be talking about traveling overseas, you know, to do all of this. So really, really grateful to the entire management of Evercare for setting up such a beautiful and efficient facility in our country.
I think we should also give kudos to the doctor, because a lot of doctors will not be this patient and, you know, take their time to keep explaining over and over again. We call him in the night, this one, no, how do we do this? So, and he'll be like, don't worry, just read up on it, it's fine. This is how we do it, this is how we do it. And you know, it was really good, and we're really grateful. Thank you very much.
The baby is doing fine. Urine is passing urine very well, and the kidney is draining also very well. However, we have to follow up this kidney with further investigations. We'll continue to monitor it with ultrasound and other advanced X-ray modalities that will help us to know the efficiency of this kidney. So we'll continue to see him, we'll continue to evaluate him as he continues to grow.